Hello, everyone. I'm Michael Luttrell, and for my lessons learned for the Institute for Healthcare Improvement presentation, I will discuss PS 202, Achieving Total System Safety. For this presentation, I will discuss 3 lessons, breaking each lesson down in steps to identify how to achieve total system safety. Lesson number 1 are the 8 recommendations for achieving total system safety. Lesson number 2, supporting the healthcare workforce. And lesson number 3, partnering with patients and families. So for lesson number 1, 8 recommendations for total system safety, the lesson objectives are to list 8 recommendations for leaders to accelerate patient safety to prevent patient harm. Number 2, to describe the roles of measurement, improvement science, and technology in patient safety. And number 3, to explain why advancing safety requires learning and collaborations across the entire healthcare system. The 8 recommendations for achieving total system safety set forth by the Institute of Healthcare Improvement are as follows. Number 1, to ensure that leaders establish and sustain a safe culture throughout organizations. Number 2, to create centralized and coordinated oversight of patient safety. Number 3, to create a common set of safety metrics that reflect meaningful outcomes. Number 4, to increase funding for research in patient safety and implementation science. Number 5, to address the safety across the entire healthcare continuum. Number 6, to support the healthcare workforce. Number 7, to partner with patients and families for safest care. And finally, number 8, to ensure that technology is safe and optimized to improve patient safety. Establishing and supporting the safety culture is the highest priority objective for healthcare leaders across the country in order to achieve a total system safety. Patient safety has made many advances since The Air is Human was published by the IHI in 1999. This report brought the issue of medical errors and adverse events to the public's attention and ultimately drove healthcare systems and the government to take action to address the problem. So how can leaders support a strong safety culture? The first way is to hold themselves and all healthcare professionals accountable for their actions relating to unprofessional conduct, but not punishing them for making unintended human mistakes. Next, errors should be identified and mitigated before they end up causing patient harm. And finally, strong feedback loops that enable staff to learn from their previous errors so that these errors do not reoccur again in the future. How do leaders support the healthcare workforce? First, they can adopt modern organizational quality improvement measures and methods so that healthcare professionals can be properly trained in safety culture. Next, they can improve working conditions for all staff within the workforce. And finally, they can involve workers in identifying domains to measure workforce safety to be reviewed by leadership to help solve problems. The next is partner with patients and families for the safest care. First, we can conduct communication training for healthcare workers so that there's better communication between healthcare workers, patients, and their families. ensure that patients and families have complete and timely access to all of their medical records, test results, and all other pertinent information that's related to their health care and that's in their health record. Organizations should include patient representatives on all of their committees so that patients have a say on safety concerns within the organizations. Encourage patients to be actively engaged in their own health care. Patients know their body and what care works for them better than healthcare professionals, and by being engaged in their own healthcare, it can help physicians and other healthcare workers ensure that they get the proper care that works best for them. And then finally, develop systems for capturing meaningful measures for patient safety incidences. And next, I will discuss the roles of measurement, improvement science, and technology in patient safety. Measurement creates a common set of safety metrics that reflect meaningful outcomes within organizations. Identifying and measuring risks using a standard metric system must be done proactively because that is the only way to advance system safety on a macro system level. So what are some of the challenges of the old way of data collection? First off, common data collection, such as reviewing patient charts or insurance claims, present challenges. Common data collection methods are retrospective ways of gathering data. However, in order to prevent adverse events from happening in real time, data needs to be collected on a prospective level because providers need this real-time data in order to keep adverse events from happening to their patients. Secondly, common data collection methods are very labor and time intensive, which can be quite expensive for healthcare organizations. And then finally, they're not always a reliable method of data collection. So what is a better way that we can collect data? Well, first, we can create systems that identify and measure risks proactively, which can prevent real-time errors. Secondly, timely feedback through improved reporting systems. And last but not least, instituting financial and non-financial incentives across the healthcare continuum for researchers to improve safety measures. The next slide discusses increasing funding for improvement science research as it relates to patient safety. Implementation science focuses on the delivery, translation, and increased scaling of lessons learned in a laboratory or pilot setting. Improvement science is helpful since most leaders and clinicians don't have experience or training to effectively apply lessons specifically focused on safety and quality. The Institute for Healthcare Improvement recommendations for implementation science include collaboration of researchers in safety sciences and patient safety. More funding is needed for government and private sources to sustain research. Number 3, they should provide incentives for researchers by increasing safety scholarship funding to promote more researchers to advance this field. And finally, they should encourage organizations to share successful safety innovations with each other, using learning labs to spread patient safety measures throughout organizations around the country. Next is optimizing patient safety using safe technology. Tech is at the center of efforts to continuously improve patient safety. While tech is a vital system used in order to improve workflow and reduce errors, it is not a perfect system at eliminating errors, and in some cases can significantly increase the scale of some errors. Also, our reliance on technology can have dramatic negative impact if the technology systems malfunction. The following improvements to technology safety are recommended by the Institute of Healthcare Improvement. First of all, there must be transparency between vendor and users regarding IT safety hazards. Secondly, must identify and measure adverse events of health IT and implement risk mitigation through best practice standards. Third, we must do routine testing to conduct and ensure that we have the safety performance throughout the health IT system. And last, we must have more effort in emphasizing and facilitating communication between healthcare organizations and patients and their families. So why is it important for health systems to advance safety measures for collaboration between one another? While there is plenty of data studying the errors and negative patient outcomes in hospitals, little data has been collected to identify other errors in other locations that patients receive care, such as urgent cares, clinics, nursing homes, and all other non-hospital-based settings. More funding needs to be provided to perform research and expand the infrastructure across the entire healthcare continuum. In order to expand infrastructure to every healthcare system, a centralized institution needs to be developed in order to collaborate and expand the safety improvement requirements to achieve total system safety. According to the Institute for Healthcare Improvement, optimization of patient safety efforts requires the involvement, coordination, and oversight of national governing bodies and other safety organizations. Next, we have Lesson 2, Supporting the Healthcare Workforce. Under these learning objectives, we will first describe the association between workforce safety and patient safety. Second, we will describe the prevalence of physical and psychological harm to people who work in healthcare. And third, we will list 3 recommendations for improving workforce safety. So how is workforce safety linked to patient safety? Well, healthcare worker fatigue, injury, and stress can result in a higher risk of errors, which can result in adverse events happening to patients. Next, healthcare workers may fear injury, especially when lifting patients, and this could lead to patients attempting to ambulate on their own without any assistance, which can result in patient falls. And next is healthcare worker burnout, which decreases patient safety and quality of care while increasing the overall cost of healthcare through the entire system. So hospitals are one of the most dangerous job sites to work in the United States. Hazards to healthcare workers include musculoskeletal injury, exposure to bloodborne pathogens, and violence, primarily by patients. In 2014, a survey found that 21% of nurses and nursing students have experienced some form of physical assault by patients in a 12-month period. And if the risk of physical harm wasn't enough, there's also the risk of psychological harm, which can be a result of dismissive behavior, subtle put-downs, unwarranted jokes, and all of these can erode healthcare workers' self-esteem and sense of well-being. Other factors can include the stress of production pressures at work, the lack of support and appreciation from leadership, and frequent demands for overtime, which can cause fatigue. So how can a good leader prevent worker harm in their organizations? 3 recommendations from the Institute for Healthcare Improvement are to be accessible, approachable, and invite participation from your healthcare staff. Next, to view failures as learning opportunities. None of us are perfect, and it is vitally important that we learn from our errors so that they are not repeated again in the future. And finally, we need to set boundaries about what is acceptable behavior and what is not. And we need to hold people accountable when they display non-acceptable behavior, to set the example for other employees of what will be tolerated and what won't be tolerated within the workplace. Lesson 3 is partnering with patients and families. Our lesson objectives, number 1, are to describe how patients and families can provide a valuable lens to improving safety processes throughout all healthcare organizations. Second, to identify practices that empower patients and families to engage in their own patient safety. And number 3, to discuss how healthcare systems can collaborate with patients and family on an organizationally wide level. So patients and families can provide a valuable lens within organizations to improve safety processes. Patients know their symptoms and responses to their treatment better than providers in most cases, so they can provide valuable insight on what things work best for them and what treatments to avoid because of their adverse effects or the fact that they just don't work well for that particular patient. They are highly invested in their own outcome. Patients can inspire and energize their healthcare team, which can boost morale throughout the entire organization. And then finally, patients can often see processes of care differently than providers and healthcare workers, which gives them a different perspective on how things should be run within the organization to promote quality and safety. The most important thing that we can do to empower our patients and families and engage them in patient safety is to ensure that they have a voice within the organization. Involve the patients and family in activities. They should have full access to their health records. They should be encouraged to engage in their own health care. And then finally, involve the patients in policy-making committees throughout the organization. And if organizations hope to have institutional-wide level collaboration between healthcare providers, patients, and their family, shared decision-making needs to be a top priority. Better collaboration starts with organizations listening to their patients, concerns, and experiences. It is in the best interest of the healthcare system to learn from patient experiences in order to make the necessary changes throughout the organization to achieve total system safety. These are my references. Thank all of you for your attention, and this concludes my presentation.
Yes.